Dr. Hossami, on the internet there are so many different diets available in regards to cancer. It's very confusing, you know, for patients to know, how am I supposed to eat? Should I follow this diet or that diet? What do you recommend here at Verita Life?
Now, as you said, there is many schools of nutrition and diet against cancer, and they might be all right, but the most diet that has a scientific evidence behind it is mostly the ketogenic diet. All right, ketogenic, it's more that the amount of sugar or the carbohydrates that is taken per day is decreased to sometimes 0%, which is or 0 to 5%, and it's more depending on the ketones, which is the fats. All right, trying to switch the cells to produce energy from more the fats rather than the carbohydrates or the sugar. All right, so what we use here is more the ketogenic diet, but we also, not everyone can tolerate, especially for example when we're talking about late stages cancer patients who lost a lot of body weight, who lost muscles and so on. So ketogenic might not be the suitable treatment, the suitable nutrition for them. So we more try to build up the nutrition according to the patient's needs. What do they do? What do they need? What's the amount of proteins? What's the amounts of fats in there? What's all the nutrients that their body needs?
And you have nutrition staff that are working
we
here
have
at Verita
the
Life.
nutritionist here, she's more building up the nutrition on, let's say, more tailor-made for the patient according to their needs. We also have control of the diet for our patients. So when the patients, they come to us, we provide them with a breakfast, lunch and dinner. All the food are organic. It's all, let's say, cooked in a healthy way and served in a healthy way as well. So we always try to target the cancers from every direction. Nutrition is a big part of it, all right? So we try to decrease all the things that can grow cancer. Even sometimes people say, I went on a raw diet, all right? And they're eating fruits and vegetables, for example. Some of the fruits, they contain high amount of sugar in it, which might be harming them also with the cancer, not helping them.
So you very much advocate a ketogenic type diet that is low in sugar?
Exactly. Low sugar. The amount of sugar is usually between 0 to 5% of the daily intake.
So that's very low compared to your standard Western diet, where cereals and breads and soft drinks and things like that would just be a normal part of the diet.
And even in Thailand, in Asia, because also they consume a lot of rice, noodles. So these are all things that most of the people around the world, they count on the carbohydrates. But always the shifting between carbohydrates and ketones and fats, it always goes through stages. Let's say the first week or 10 days can be difficult, but
is this because the body is so used to functioning off sugar as a fuel, and then making that transition to function more from protein and fats can be uncomfortable at the start?
Exactly. At the beginning it can be a little bit uncomfortable, but let's say once we pass this transition, then the patients feels more healthier, they have more energy. It comes, let's say, a great outcome for them, and also it helps them while they are going under the treatments with Verita Life and their cancer treatment.
I think a good thing about Verita Life as well is that the food's all provided here.
Exactly.
So you don't have to worry about how to prepare a ketogenic meal because it's done for you. And once you've experienced that for the time that you're here, you can go back home and carry on with those types of recipes or eating in that particular way.
Exactly. And whenever we have now the recipe book also for the ketogenic diet, and whenever a patient can, like say they like a recipe or they want to know how it's done, the nutritionist can take them into the kitchen and teach them how to cook it and how to do it. So we can have also some classes for the patients or for the caretakers of the patients in order to know what is the best, how to cook and so on. So the nutritionist is always providing this for the patients here.
And Dr. Hossami, as an oncologist, would you say that food is medicine?
Of course.
Yes?
Exactly. Food and nutrition is a big part in the cancer treatment. It's not, we cannot just tell the patient, go eat whatever you want, all right? There's things that enhances immune system, there's things that is killing cancer, let's say, and helping in the treatments against cancer. So nutrition and food is very important, and it is a very big part of the treatments for the patients.
Okay, great. Thank you.
You're welcome.